If you look back at kind of the 10 years, what were the biggest wins that you had during your career? What were some of those, and what were the conditions that led to them?
Yeah, I think the one I would say is probably the biggest um, win. It was kind of putting in the concierge advocacy type programs within the health plan, without going, without going to the industry. And I think the part of that was kind of coming off the tail end of like that whole realization about consumerism. We've made healthcare difficult. We made benefits something to deal with, and sort of we had a rally
Right.
cry of how do we, I love the rallying cry of like, hey, let's put the benefit back in benefits. These
Yes.
are supposed to help
I think it's
people
something that
live.
people value.
Yeah, this is supposed to help them live better. It's supposed to help them with their health. So what we kind of looked at the healthcare system. It's fragmented, as we all know. You've got point solutions here. It was kind of the early advent of the point solution uh, program. So we're kind of like seeing just
Yeah.
even the fragmented parts of healthcare systems, and kind of said what we need is the back of the ID card had 13 phone numbers on it. The typical ID card. So like we're gonna create one, and we're going to change the rules of engagement. It's not about call speed to answer, handling calls, and it's how do we kind of help navigate employees or bring employees through the healthcare system, but also in a way that tried not to create artificial points of engagement. And I'm trying not to mention vendor names because I don't want to go through, but just sort of looking at, so how do you leverage some of the existing plumbing or some of the existing natural engagement points? So we went to the health plan and actually built an engagement platform and kind of said,
Mm.
your job is not just to answer questions. We're going to equip you with broad senses of data. We're going to equip you with all the information. You are not powered just to answer questions. You are powered to ask them and recognize
Mm.
where employees may have a gap in care, where employees may be looking for resources, and bringing them awareness to them. So, you know, the someone calls up for an EOB on a first-time cancer diagnosis. Your job is not just to answer how that claim is paid, but to understand that that's a cancer diagnosis. That might be an opportunity for behavioral health engagement, someone to talk to, or you have you have a cancer program for best practices and centers of excellence. You can inform the employee, and so your job is not to get off the phone fast. It's actually the opposite. It's to ask, follow up, see how they're doing, and guess what? You're going to call them in a month to see how it's going, and you're going to do the reach out call. And
Interesting.
it takes a little while for employees to actually answer the phone. It's been hard, but it was probably the single most value added thing we did to employee populations. We got more wow, thank you, like unsolicited thank yous from employees. And something as simple as trying to solve an EOB. Like I've had this EOB outstanding for 18 months, couldn't get it fixed. The person, the new, I'll try to avoid the branding name, took it, ran with it, got it fixed, resolved it. It's the best thing that's ever happened. I've used it personally when I've had to get surgery. All right, where can I go for the hospital? Get me the information. They'll do the research for the doctor for me. So you're leveraging the pieces that were the kernels of consumerism, but I've made a healthcare expert who can interpret it be able to bring it forward. And that was probably, again,
Hmm.
it wasn't a huge design, but it really, and it in many ways put the benefit back in benefits for a lot of our employees, because it actually helped hit the people that needed healthcare the most, were in the most critical conditions, didn't know where to find a provider. It sort of hopefully got them from asking their neighbor for the specialist, or the doctor saying, we'll get you someone that's highly rated within network and all of those things. And just the health, and some of it was just the call. Hey, how's it going? Anything I can do for you? Hey, I'm doing great. I'm fine. But just giving
Wow.
someone the sense that they cared. It was the single most impactful thing that we did.